This is Manhattan Insights, a Manhattan Institute production. I'm your host, Raihan Salam. As federal spending on Medicare grows in the coming years, the U.S. will be forced to make hard choices. What will it take to put the country on a more sustainable fiscal path? Is entitlement reform really the political dead letter that many make it out to be? Chris Pope is a senior fellow at the Manhattan Institute whose work focuses on healthcare policy. He is also a political scientist who has thought deeply about our federal system and the future of federal spending. He joins us this episode to discuss the politics of fiscal consolidation.
Deep down, why is capitalism popular in America? It's because it puts individuals in control. Why is American healthcare unpopular for so many people? Because it takes them out of control. It says your employer is going to boss you around and tell you what your healthcare plan looks like.
Chris, we're just coming off of a very fraught debate over raising the congressional debt limit. Members of Congress are still debating whether or not that was a sound agreement, where to go forward. But one thing that was striking is that Republicans wound up coalescing around, originally, this proposal called the Limit, Save, Grow Act, which envisioned very stringent caps on discretionary spending, yet that didn't really touch Social Security and Medicare. I wonder what you think about that. Is it possible to achieve some kind of fiscal balance without addressing Social Security and Medicare long term?
Well, it's certainly the case that in the long run, Social Security and especially Medicare are the big contributors to the deficit and to the debt increasing. Now, the question is, can a minority party can a party that controls one chamber of Congress and not the presidency do that by themselves? The answer to that is obviously not. But it's certainly true that Medicare and Social Security are the big problem that we face. And they're a problem that I think no one is trying to tackle, certainly this Congress.
You say problem, but can you give us some further detail on exactly what that looks like?
Yeah, so if you take basically one generation, like 25 to 30 years, we're basically projected with no increase on current spending, on current law, to have government spending increase from 20% to 29, 30% of GDP. So in terms of the federal government, it's as if you have the exact need to finance the current level of federal spending, and you need to finance another 50% on top of that. And that's not expanding Medicare at all. It's not even expanding Medicare to a few more than are currently in it. It's just the existing law, the existing federal programs for existing beneficiaries. Just because of the commitments that have already been made, our spending is on track and basically committed to increase so substantially.
Why is it that you have seen fiscal consolidation fall off the political radar for the past several years? If you're looking at the Trump presidency, for example, it really didn't seem as though Republican lawmakers or Democrats were especially exercised about the threat of looming federal deficits. Why exactly did that happen?
Well, it's a good question. I mean, I think part of it is that they'd actually enacted some legislation in the previous decade, in the 2010s, that had taken some bites out of the problem. You'd seen the sequester that went through the Budget Control Act when John Boehner was Speaker, the agreement with President Obama. That reduced domestic spending and defense spending quite substantially. There were various Medicare reforms that went through that trimmed Medicare payments quite substantially. There was a slowdown in healthcare cost growth relative to what was expected. That reduced spending relative to projections. And then I think why it fell off the agenda, I think the pandemic was really important in that respect as well. The pandemic was obviously an emergency situation. There was a belief that private demand was going to drop off substantially and that you needed sort of a Keynesian public spending response. And so the fiscal constraint was off completely for a couple of years. And Congress really took advantage of that, really took the invitation to spend an enormous amounts of money, which then ran into inflation, ran into a lot of the fiscal constraints and a lot of the monetary constraints that we worry about more traditionally. And then the main fiscal problem, which we'd always known, was the longer term entitlement problem. And every year, more and more boomers were retiring and more spending was increasing. And so those problems of Social Security and Medicare cost growth have sort of grown up on us, as it were, in the intervening period. And those are set really to keep on growing into the future.
Tell us about the role of interest rates. One line of argument is that given rapid aging, both domestically and globally, there was this kind of downward pressure on interest rates that made some of the fiscal challenges less urgent. Do you buy that?
Yeah, I think it was certainly fairly cheap for the federal government to borrow, for a number of years over the past decade or so, really since the Great Recession. But the willingness of people to hold federal debt, which was obviously and always is a somewhat relatively safe asset, runs into trouble when the federal debt to GDP ratio escalates to the rate it has over recent years. We're headed to go over 100% of GDP, and that, well, once it starts compounding, that becomes a problem of itself. Now, if you sort of look at the long-term deficits going forward, you have actually buying services, mostly healthcare and pension benefits, but the actual largest dollar figure going in the next few decades is just going to be debt interest payments. And if you actually sort of look at the projections of what the federal government is going to be spending most of its money on, paying off past debt, which has until recently been a fairly small part of federal spending, will become an increasingly dominant part of federal spending as it compounds over time.
And even if interest rates once again trend downwards, let's say we're in a kind of idiosyncratic moment right now, you still think that pressure of debt service is going to be relevant?
Well, I think it's no. Obviously, I don't know where interest rates are going, or I could make a fortune bucking the markets. But if you sort of look at what the markets think, the markets clearly believe, as a central point, that they're at a level that's going to cause increasing compounding debt growth. Now, they could be wrong, but they could be wrong in both directions. So they could be overestimating interest rates, but they could equally be underestimating interest rates. And I think as a sort of long-term historical level, it's fair to assume that that existing interest rates or sort of long-term historical interest rates are going to remain broadly correct. And also, I think it's fair to assume that the more and more we borrow from abroad, the more limited that tolerance is going to be to sort of keep fueling an exorbitant privilege of the United States to borrow, especially to the extent that a lot of our borrowing comes from geopolitical rivals who could very easily all of a sudden reel that back in. And especially if the debt is compounding, you really are, no matter what the limit appears to be at any particular moment, no one doubts his theoretical point that there is a limit to the capacity to borrow before you run into interest rates. So the debate isn't whether, it's at what point.
You mentioned earlier on that medical cost growth was slower than anticipated in the years leading up to the COVID crisis. I wonder, was that a function of depressed economic growth because, rising affluence tends to lead to rising medical expenditures? Or was there some other reason? Was there some policy intervention that helped restrain cost growth in the healthcare sector?
Yeah, I think so. That is definitely something that economists have looked at. The easiest part to look at is obviously the public sector part of healthcare spending, which is about half of healthcare spending. And in that respect, it was very clearly the result of tightening payment caps, tightening price regulations for Medicare, for Medicaid, which slowed basically reimbursement for hospital care, especially. And so you had a slowdown in that respect that was pretty clearly the result of policy on Medicare. But there is actually also a spillover from the public sector to the private sector in that respect. The more constrained hospitals are with their ability to gain reimbursement for investments from Medicare and Medicaid, the more reticent they are to make those new investments, those increases in capacity across the board. And then I think there actually is something which is there is a dynamic, which is the percentage growth of healthcare spending will tend to slow, just because if you're increasing healthcare spending by $20 billion a year, because that sort of that figure is a smaller proportion of a growing stock, as it were. So the percentage growth will tend to slow down purely as an arithmetic factor.
Talk to us a bit about the politics of entitlement reform. There's a striking difference between 2012 and 2016. In 2012, the Republican presidential nominee chose as his running mate Paul Ryan, a member of Congress who was renowned for his commitment to carving out a path to fiscal sustainability, someone who certainly was willing to take political heat for making the case for fiscal consolidation. And then in 2016, you have a Republican presidential nominee who, was in a sense a very successful policy entrepreneur, an innovator, who said that, hey, look, I am going to leave Medicare and Social Security entirely untouched. You can trust me to do that. And many would argue that that was really decisive in giving him a victory in 2016. And of course, having seen that success, that seemed to have shaped the playing field for many other Republicans as well, leading up to something like the Limit, Save, and Grow Act, where, you're not even talking about entitlement reform being a part of this path to fiscal sustainability. So I wonder, tell me a little bit about what happened over that intervening period. Was Trump someone who was sui generis, or were there already currents of skepticism regarding making a case for entitlement reform? Was it this low interest rate environment that really kind of took that off the table? I'm curious how you saw that evolve.
Yeah, well, I think so much of politics is really an interaction between almost two very different types of politics. You have elite politics and you have mass politics. And mass politics is all about mobilizing large amounts of voters. And an easy way to do that is to point to tax cuts or to the opposition to tax increases, or to point to benefit cuts or the opposition to benefit cuts. And I think that's the extent to which entitlement politics plays into mass politics. And I think that means that as a matter of mass electoral appeal, entitlements as such are never really going to be why you win elections. I think you will win elections if you're a Republican on the tax issue. And if you're a Democrat, you will certainly win primary elections by proposing entitlement expansions. But you can't just propose entitlement expansions or tax cuts or opposition to tax increases. So mass politics doesn't really work by itself. You need to actually deliver them. People wouldn't be interested in them, in your proposals. Voters wouldn't be interested in your proposals unless you really were able to deliver on them. And that's when elite politics comes into it. To deliver tax cuts, or you need to oppose benefit increases. You need to restrain the cost growth of entitlements. To propose entitlement increases, which to win a Democratic primary, you need to have a plan to pay for them. And to do that, you need to engage in elite politics.
But you're positing a very hard budget constraint that's disciplining political discourse, when in fact we've seen plenty of evidence that politicians have been willing to expand deficits, right? At least in the kind of recent past.
Well, I think over the long run, the budget constraints are certainly there, and congressional procedure is set up in such a way to make budgets constraints.
So what you're saying is that even if there is deficit spending, the deficit spending is restrained relative to a counterfactual in which there was total indifference to fiscal balance.
Well, I mean, if you look even at the Affordable Care Act of 2010, most of that was paid for through cuts to Medicare. This wasn't because Obama necessarily or congressional Democrats had necessarily an ideological commitment to doing that. They were constrained by procedure in doing that. They were constrained by concerns as to keeping the price tag down, to not really being boxed in the tax increases they would have opposed.
Can you elaborate on the procedural constraint? Was this the nature of the reconciliation process? Tell us exactly what they saw as the relevant procedural constraint, leaving aside the political constraint.
Well, so I mean, the procedural constraints come from various different places. A key one is obviously the reconciliation process doesn't allow you to make a change to the deficit beyond 10 years into the future. So that means that any change to entitlements beyond 10 years has to be fully paid for. Now, in the case of the Affordable Care Act, there was obviously the complication that there were two separate bills. There was the first bill, which was passed with 60 votes, that was exempt from that constraint. And then you had the second bill, which was subject to that constraint, which was the reconciliation bill. And so they wanted really to set up a permanent entitlement. And so their ability to alter that was constrained. And obviously they didn't have any votes to spare insofar as they were concerned about the 60 votes. Now, there are also congressional pay-as-you-go budgetary rules which apply. Now, these have been changed over time, but these essentially mean that any entitlement expansion, any expansion of Medicare through statute has to be paid for. You need to find a revenue stream for it. Now, you can bang the fist on the campaign trail arguing for Medicare for all as much as you want. But if you don't have a real practical proposal for a tax increase to pay for these, it's just not going to happen as a matter of getting through Congress. And so there is a real disconnect, sort of in theory, between what's an applause line on the campaign. We know this, getting Mexico to pay for the wall versus actually building a wall. These can be two separate things. Well, it's the same thing with, say, Medicare for all. That the applause line on the campaign, if you actually want to make it real in terms of policy, you need to win in the elite politics as well. You need to have a plan to navigate that. And I think sort of bring it back to the 2012, 2016 issue. I think what we had is you had a Republican Party that was playing two different kinds of politics, or kind of dominated by two different kinds of politics in the 2 different years. Paul Ryan was very much the insider, how do we get this through Congress type of person. That was his objection, his concern, and I think he won Mitt Romney around to that way of thinking. And then in 2016, Donald Trump had a very different attitude, which was, how do I win the primary? How do I win the general election? We'll figure out the policy separately. And I think that it was with two very different types of motivation. And I think it sort of explains why once Trump got into office, the one thing he ended up doing was the tax cut bill, which Paul Ryan had planned, because Ryan did have that strategy to get things through Congress rather than winning a presidential primary. And it shows why some people who are very successful with one type of politics can be very unsuccessful with the other type of politics, but you really need both to be effective as a president or as a legislator.
Now, does taking an explicit rhetorical stand against entitlement reform necessarily constrain you? Or is your point about mass politics and elite politics, the inside game and the outside game, that to some degree those pledges are immaterial, and that what happens is what you do, in the process of horse trading about legislation operating under these sometimes quite stringent fiscal rules?
Well, that's a very, very important question, a very good question, and I think a question I think a lot of politicians probably wrestle with a lot of the time. Something to really bear in mind is the 2008 Democratic presidential primary. You had the big difference between Hillary Clinton and Barack Obama's policy proposals was that Hillary Clinton supported a healthcare mandate, and Barack Obama opposed a mandate to buy health insurance. And he had all sorts of reasons why he thought it was unnecessary. Well, obviously, Obama gets elected. He then signs the Affordable Care Act into law, which has the mandate, which is essentially much closer to Hillary Clinton's healthcare plan than it was to his own healthcare plan. Now, I think ultimately the question is, are your voters going to forgive you for it? Or are the voters that you need the next time to get reelected going to forgive you for it? And that is probably going to depend on how much you're deviating from what you've pledged, to what extent your base is sympathetic to the trade-offs you are going to make, and then ultimately, are you going to be running again? We have a long history in American politics of presidents in their second term who are much more willing to kind of sell out their own base than they would be in the first term, because you don't need them for re-election. And so we certainly see that members of presidents in their second terms with the Congress of the other party will very frequently sign off on legislation that they might not have been willing to do in the first term.
I want to get back to the politics of fiscal constraints. So you're arguing that when you're looking at the recent fiscal history of the United States, yes, you've seen deficits expand. Some of this is the COVID experience. Some of this is perhaps lower interest rates and the kind of climate that gave rise to. But you're saying that there still were some constraints there because there is some recognition that rising spending will have to be balanced out against rising taxes. But of course, when you're looking at contemporary politicians on the center left and left, the classic argument is that we will shield middle-income households, and of course middle-income households can be defined very expansively, from tax increases, and we will limit tax increases to the top 1%, the top 0.1%, the top 0.01%, or kind of however narrow you want to go. And it seems as though that political formula has been relatively successful. As I understand it, what you're arguing is that middle income tax increases, the prospect of middle income tax increases is something that could have a meaningful political effect. But if you have one side of the aisle claiming that we will completely shield you from those increases, yet we will also pursue entitlement expansions, how exactly does one respond?
Well, I actually think, you look at the Democrats just last year, they controlled both houses of Congress, they controlled the White House. And they found it very, very hard to increase taxes on upper-income households. President Biden said he wouldn't increase taxes, or he would increase taxes implicitly on households with incomes above $400,000. And he found it very, very difficult to do that, not because of Republicans, or in part because of Republicans, but pivotally because of members of his own caucus. Because it's not just federal taxes that we're talking about that are the upper marginal tax rates. There are also state and local taxes, certainly in New York City. And so Biden ran into the problem that a federal tax that might have had a top marginal tax rate that might have been intuitively appealing to voters at the purely federal level, say a 40% top marginal tax rate, raising the top rate to that level. If you add it on to New York state income tax and New York City's income tax, all of a sudden you're talking about marginal tax rates that are very, very high, and especially in areas where Democrats are members of the House, and especially following the elimination of the cap on the SALT deduction, the state and local tax deduction. This posed a very big problem for Democrats in his own caucus, and it's why even that was very, very difficult, and Biden wasn't able to generate any real revenue from that.
So are you saying that Starve the Beast has actually worked? If you're looking at the past 40 years of reductions in the tax burden on middle-income households, that this has in fact been a quite effective strategy for constraining the growth of government?
Yeah, I think the revenue constraints have always been the primary determinant of government spending. Why was the federal government so small in the 19th century? People, I think, will often imagine that this was because of constitutional law. But then people find all these exceptions. And actually, the government did do lots of things in healthcare in the 19th century. And actually, the government did a lot of things in the name of the general welfare of the 19th century. The big constraint was the fiscal one. It was that you couldn't really assess a mass income tax because most people lived on farms. And so you couldn't assess incomes. Property tax is very arbitrary in a agricultural population, so you couldn't really impose a very broad property tax that was going to generate a large amount of revenue, and that which was being imposed by state and local government. And so the federal government was left with the tariff, essentially, which generated a small amount of revenue, but that was very distortionary, and that very much kept the federal government limited. What we saw in the 20th century is then you have the income tax, which straight away replaces the tariff pretty easily with rates of maybe 4 to 5%. Then the big decisive change is World War I, which shows the federal government, wow, you really can generate an enormous amount of money without very big problems from the income tax. And spending rises to that level. Taxes go down a little bit after World War One. And then World War II turns what had been a modest income tax on the richest third of the population into basically a tax on most of the population at very substantial rates. The war justifies it. And spending never really comes down after World War II. It was really entirely on the revenue side that we see changes in government spending determined. And that's with very, very large changes in revenue. Over recent years, we've seen very small fluctuations of revenue. I mean, you look at federal revenue, over recent decades, it bumps up and down between 16 and 19% of GDP. So the variation is fairly small. But even then, you see politicians adjusting government spending to fit within that broad constraint. It's very, very hard to substantially increase federal spending. You might be able to increase it by like 10% on that level, but that's not a qualitative change. It doesn't change the role of government. It's really on the revenue side. And the thing that I think has masked this has been, since World War II, we've had an enormous decline of defense spending. And so for many decades, you had a big increase of domestic spending, which seemed to be coming without tax increases because defense spending was going down. And the reduction in defense spending was funding the great increase of the post-war welfare state without tax increases. And that was the era of democratic dominance, basically from the 50s until 1980, where it was basically playing that game. What happened in the late 1970s? What happened in the late 1970s is the defense spending basically hit a floor. It couldn't really. Everyone agreed that it shouldn't really go any lower, and the commitments and spending were going higher and higher. And so, since basically Reagan's election, Reagan essentially won on a tax revolt. I think it's fair to say. The revenue has been constant, and the spending, really, in the grand scheme of things, has flattened out in line with that. And this really is the large trend. We're kind of pretty much where we were in 1980 in terms of revenue being constrained and spending being constrained. You might see a small fluctuation a little bit around that trend, and there might be a little bit of wiggle room with interest rates. But in terms of grand qualitative changes in the size of government, that really has been off the table for 40 years because of the revenue side. Except
that, as you observed earlier on, assuming federal spending is on autopilot, you're going to see it go from 20% to 29% of GDP. So what you're positing is that, essentially we've had this rough settlement for several decades now. It hasn't necessarily been recognized as such, and that settlement is now coming under intense pressure, and that creates an opportunity for advocates of entitlement reform. Is that a fair characterization of your view?
Well, I would say that you can look back at Congressional Budget Office publications from the past 2, 3, 4 decades, and they all have the trend going up in the near future. But Congress keeps acting to rein in spending. It doesn't boast about the fact that it's doing that. It doesn't say, oh, we're cutting all these programs. But ultimately, members of Congress of both parties are more afraid to raise tax rates than they are to to reform government spending programs. And the reason for the asymmetry is this, is that raising tax rates means taking things away from people that they're currently expecting. So you have a household budget, you're expecting to lose however many thousands of dollars to the government in taxes every year, and you budget on that on a weekly basis, a monthly basis, and it's really disruptive to your life to have the tax rates go up if you're a middle-income household or a lower-income household. And when you look at what the spending trend is, pretty much all the spending items, when you look at it, the growth isn't just carrying on the programs as they are. There's an assumption that the program is going to be gradually expanded over time. There's an assumption that benefits are going to increase generally. So we have a lot of benefits that are, Medicare is the best example of this. And if you look at the biggest sections of the entitlement cost problem, it is Medicare, it is Medicaid. And the cost growth is from the proliferation of services. It's new technologies being invented that are being added to the benefit under current law, certainly, but no one is currently receiving them. And this is what we find sort of over recent decades, is that it's been possible for Congress to basically provide a payment reimbursement, basically payments for services, which slows down the proliferation of new services, which kind of reins in spending and kind of means that they always seem to fall below the projections of the Congressional Budget Office.
So in a sense, this is a very sanguine story, because what you're saying is that fiscal doom is something we've been anticipating for some time, and yet it's always forestalled by these pragmatic, below-the-radar, unadvertised tweaks that are made to programs. I wonder if we could dig into this a bit on the Medicare side. One observation you've made is that while many politicians, certainly on the left, but also President Trump and some others on the right, have said we will leave Medicare untouched. In fact, you've observed that Medicare is constantly being touched. There are all sorts of small ways in which provider payments are being tweaked in order to finance other priorities. Can you tell us a bit about that pattern?
Yeah. So, I mean, Medicare as a program is a very micromanaged program. The government essentially sets prices for tens of thousands of medical services, not specifically each service, but it has formula which apply to each of the services which generate these tens of thousands of prices. And so by tweaking these formula, Congress can basically greatly influence what is being paid for all these services across the board. And also not just existing services, but when you set a reimbursement rate for a drug or for a surgical procedure, it influences how many new facilities offer this drug or surgical procedure, how many come into business, how many new ones are developed, their availability, the degree to which they're provided efficiently with large degrees of economies of scale. When you set a price for an MRI scan, for instance, you're basically setting the threshold for how many MRIs per scanner you can cost effectively use. So if the price halves, it basically means that you have to use it much more intensively for it to be worth buying an MRI scanner if you're a new facility. And if you reduce the price, it greatly reduces the proliferation of scanners. It basically says that you're going to have a much more intensive utilization, people booked in appointments throughout the day. And the tendency of healthcare spending is very much like that throughout. Physician services, hospital procedures, devices, and drugs. And so by tweaking these formula, these are things that are very hard to report in the news. It's very hard to basically turn an abstract issue of exactly how many CT scanners we're going to have in 10 years' time into a messaging campaign messaging.
Partly because it's not necessarily something you're losing, but rather it is capacity that's not being increased, and one could eventually bump up against some implicit form of rationing. There could be frustration, but I suppose what you're saying is that the political art is to manage things so that actually you're not putting too much pressure on the providers, on the beneficiaries, so that it's almost imperceptible, but in fact you're slowing down the rate of growth.
Exactly. And so it's a lot easier to, if we say in air quotes, cut Medicare or slow the rate of growth, really, than it is to actually raise taxes, because the tax increase actually is a very visible disruption of the status quo.
But Chris, there is one really notable and important difference, one important asymmetry, which is this. When you're looking at politicians on the center left and left, when they are advancing these tweaks, these reforms that wind up generating some fiscal savings, typically they will say we want to apply that to some other benefit expansion elsewhere. The Affordable Care Act being a paradigmatic example of this, where you had large reductions in future growth of planned Medicare spending that were then used to finance new social programs, but also more recently with the Inflation Reduction Act. The Inflation Reduction Act was very heavily financed by similar trims to future Medicare spending. So I suppose you could say in that case, well, hey, we are taking something, quote unquote, but we are also giving something with the other hand. But when you are on the center right, when you're a fiscal conservative, who is saying that we should trim the growth of Medicare. You can't say I'm trimming the growth there to give you some other concrete benefit here. What you're saying is that I'm going to trim the growth here so that we can keep taxes low. Is that roughly right?
I think that's right.
And is that a less compelling pitch when you're talking about the median voter?
Yeah, I mean, it is interesting to sort of think about how this interacts with electoral politics. Because if you think back over the past 30 years or so, which reforms have been the most, or when have you had reforms that have gone disproportionately to basically cutting spending versus Medicare cuts that have just gone to other programs? I think you definitely find that when Democrats have had unified government, Medicare reforms have gone to other programs. The savings have gone to Medicaid expansions traditionally, or they've gone to, environmental spending or other entitlement increases or, bailing out union pension plans or that sort of thing. But if you look at divided government, and I think of the 1997 Balanced Budget Act, I think basically the sequester in 2010, 2011. Now most of the Medicare cuts there really did go to reducing spending and largely didn't increase other programs at all. I think in the 97 Balanced Budget Act, the CHIP program was created, but I think that was actually offset by a tobacco tax. So it wasn't actually the spending cut as such that was paying for that. So, I mean, the partisan politics do matter. What's striking, actually, is that when you've had Republican unified government, cutting Medicare and just cutting spending, that's been politically less appealing. It's been, Republicans haven't been able to have Medicare cuts that have immediately gone into tax cuts. But by doing the tax cut first, they've generally been more successful at, and this is what we've seen over the past 30 years. Republicans have passed a tax cut under unified Republican control of government.
Interesting. So what you're saying is there's an iterative process, and Republicans basically hold down the revenue share of GDP, and that creates a new playing field that others have to accommodate. Now, of course, there are folks on the center left who would say that this is a very cynical strategy that then ties the hands of the center left when they're governing. But it is interesting because, it also means that folks on the right are constrained. Because if, Republican unified government can't pursue unilateral spending cuts, that seems concerning, right? Because, when you're in the position to pursue those spending cuts, you can structure them, you can design them, you can make them perhaps more constructive than they might be otherwise. You can, have them more closely reflect the ideological sensibilities that you want embedded in these programs. So, I guess one interpretation of what you're saying is that the kind of left has this political advantage when it comes to structuring the entitlement state, and the right can, constrain them to some degree, but the right hasn't really demonstrated an ability to structure it differently.
Yeah, I mean, that's an interesting question whether, and I certainly do accept the premise that Republicans have not been very successful with unilateral benefit cuts. That they've been trying to
whereas Democrats have
spending.
Managed to advance some unilateral entitlement expansions, the Affordable Care Act being a good example,
but on the
and
other
the Inflation
side,
Reduction Act.
On the other side, Republicans have been able to unilaterally cut taxes. Democrats haven't been able to. I mean, in 1993, they unilaterally increased taxes,
and there's a huge backlash,
and lost Congress for the first time in 40 years. So I think that is the symmetry. The symmetry is Republicans want to cut taxes, Democrats want to expand benefits, and then the inability to really go too far with either of those things creates the fiscal constraint and forces them both sides to negotiate. But the question is, there's the other issue is, are Republicans, have they just advanced bad ideas on benefit cuts? Like most of the benefit cuts, the traditional benefit cut is actually an eligibility reduction. Republicans want to do on Medicaid, or they want to do on Medicare. They've had ideas of premium support. They've had floated ideas of premium increases. These are painful ways to do them. I've wondered whether, and I have recently written about that, if we thought about Medicare's cost and acknowledged that Medicare's cost growth comes from increasing spending on newly developed technology, is that something Republicans could do unilaterally? Now, I think that might be difficult, just because I think any cuts have to be, the question is, like, what is the benefit? Like, any cuts have been, like, the question is, do you tie it to a benefit? And again, the strong point in politics is the status quo. Anything that you can show as the status quo, you're generally invulnerable. So opposing benefit cuts is a strong point politically. Opposing tax increases is a strong point politically. If you're trading a benefit cut for a tax cut, well, the status quo is basically opposing that package. Conversely, if you're trading a benefit increase for a tax increase, a fully funded tax increase, that's also pretty hard to do because you're standing against the status quo. And so this is why I think we've tended to see things happen more. You get a unilateral benefit increase or you get a unilateral tax cut, and then the financing is basically dealt with on the back end in divided government.
It's fascinating. So what you're arguing is that if entitlement reformers want to succeed, what they need to do is leverage the status quo more effectively and basically occupy that high ground by saying that, hey, we're not calling for cuts relative to where we are right now. Rather, we are talking about changes that will actually keep something like the status quo intact. Tell us about how you actually pull that off.
Well, I think when you look at Medicare, for example, the fact that the cost growth is really coming from the incremental expansion of the benefit package, the open-ended commitment to pay for whatever new technologies are developed without paying for them. Now, that's an arrangement that's inherently increasingly costly and is driving is the most important share of the federal spending increase over coming decades. But it's also a disruption of the status quo. So there's one of the things that I think you find in legislative politics is that the status quo can mean different things. It can mean the statutory status quo, but it can also mean the status quo in terms of substantive benefits that the voters are accustomed to receiving. And I think in terms of mass politics, in terms of mass electoral politics, that latter one is the one that's really important. What members of Congress are afraid of is old ladies hitting their car, as Dan Rostenkowski suffered a couple of decades ago, saying, you're making me pay for stuff I didn't used to have to pay for, or you're taking away things from me that I'm accustomed to receive. And it's the substantive changes that are really politically painful. It's the disruption that people's life. Because most people, ultimately don't pay that much attention to legislative politics. No one's scrutinizing the details of legislation, but people really realize when their own lives are disrupted. People really realize when their budgets change.
I'm not sure you're right about this, but it is really intriguing. So, one simpler way to put this is that the standard of medical care in 2023 is something that will become cheaper over time in relative terms as we become more affluent, and that will be intact, and you will have access to that in 2025, 2030, 2035, et cetera. So that's one interpretation of the status quo. You will have your 2023 medical care guaranteed. Now, in 2035, will you get 2035 cutting-edge medical care? Maybe not. Maybe that's a different question. So that's an interesting question. What is the status quo? Is the status quo that you will have nearly limitless access to cutting-edge medical care, regardless of how expensive cutting-edge medical care is at any given point in time? Or are you being guaranteed a standard of care that is not the same kind of moving target? And I'm actually not sure, how that would play out in mass politics. But it seems that your intuition is that to say that we are not going to take away benefits from you, we're just not going to say that you can have access to the kind of cornucopia of medical innovation that, kind of this or that, kind of entrepreneur might want to introduce.
Well, I'm also not saying, firstly, that you would withhold access. I'm saying that to the extent that medical care is made available and developed that isn't available now, you would just have to pay a risk-adjusted premium for it. Like as a beneficiary, you would be expected to provide the funds for the additional improvements. And secondarily, to the extent that Medicare shapes the nature of technology that is developed. Because Medicare is currently set up to pay indiscriminately for technology, regardless of its value. What's the easiest technology to develop? Well, fairly ineffective, fairly expensive technology that doesn't really have a great impact on patient care. If Medicare suddenly becomes price sensitive or more restrained to new technology, then the new technology that is developed, entrepreneurs will start thinking about cost more. They will start thinking about, well, I'm not just going to invest in this new device because it's got the highest reimbursement rate. I might invest in this other device because it's cheaper than the ones that currently exist. And that's a very different type of innovation. You can have a Medicare as a public payer incentivizing cost-reducing innovation, not just cost-increasing innovation. And that's a very different dynamic.
Interesting, but those would still be new procedures, right? I mean, when you're talking about some of these new innovative therapies that are cost-effective, I see. So what you're saying is that if Congress is saying we're going to assert ourselves and we are not going to, allow this to happen on autopilot, we will finance cost-effective medical procedures. We will not finance medical procedures that are not or not yet cost-effective, and that's going to incentivize a different path of medical innovation.
Exactly. And
is that expecting too much of Congress? I mean, is that expecting a degree of sophistication that you don't necessarily have, given the constraints on congressional staffs and what have you? It seems that Congress is very keen to punt on these things to administrative agencies. I wonder, can you really imagine Congress wanting to take on this authority?
Congress responds to the incentives that are in front of it, like everybody, right? Members of Congress are people. And to the extent that congressional budgetary procedure has a gigantic loophole for the addition of new technology to Medicare, which means that it doesn't have to be paid for by them, they will be essentially indiscriminate in accepting and kind of ignoring the cost of such things and let that balloon. To the extent that members of Congress have to find pay-fors for increases in medical technology, they will do so. They might not do so directly. That's fine. They might create delegate that authority to an agency like MedPAC, which is a very sophisticated agency full of very qualified analysts, and they might largely ratify those recommendations. But the basic problem is that it has no incentive currently to pay any attention to these costs because it doesn't come, it kind of falls between the gaps of different procedural constraints that Congress has in the past set up for itself. I think the thing to sort of recognize with Congress is that Congress sort of is able to recognize different priorities or different priorities over time. Congress is able to act in the short run. But then also members of Congress, they are able to think that, oh, we don't like these 30-year trends. Let's pass a long-term piece of legislation. And the strange thing is it's actually sometimes easier to say, let's do this procedural change to bind our own hands over the next couple of decades without really getting into the details of where the funds are coming from. And then once the future Congresses are constrained by the change in procedure, then they are actually subject to an incentive scheme that's very different. And we see this all the time. I mean, Congress has passed the Budget Act. It's passed pay-as-you-go rules. It's passed reconciliation procedures. It changes its own budgetary procedures constantly, basically to try and to try and force future Congresses to deal with these challenges, or to basically limit the bad decisions that future Congresses can make. And this generally proves pretty effective. My main argument recently has been that there's been an enormous oversight in the types of spending categories that are covered by these procedural constraints, and they've forgotten to deal with the issue of new procedures being added to Medicare, new medical procedures and technologies. That is essentially a loophole in all the restraints that otherwise force Congress to pay for new spending.
I want to give listeners a sense of the magnitude of Medicare expenditures and how they've changed over time. A 2006 CBO study concluded that Medicare payment cuts over the past 2 decades had slowed the annual increase of per beneficiary costs from 5.5 percentage points above the rate of economic growth to only 0.9 percentage points above it. In 2007, the CBO estimated that Medicare would grow to 3.9% of GDP. By 2021, in fact, it cost 3.1% of GDP, a savings of almost $200 billion, more than the entire federal spending on transportation in that year. I lay that out just to underscore that it really is true that we've had galloping growth in Medicare expenditures in the past, and almost without noticing it, we really have managed to cram that down. So what you're saying is that rather than being really anxious and terrified about the future path of Medicare spending, actually it's quite easy to imagine entitlement reform happening with a whimper, not a bang.
That's right. one of the typical features of politics is it's very easy to make a fuss about something that might not be a big problem. There's a big part.
Or maybe the making of the fuss is why it's not a big problem.
That's also true, right? But maybe I meant in a slightly different sense, right? People have been afraid of cutting Medicare overtly because they're afraid of being attacked for cutting Medicare, attacked of the terrible consequences that will entail if spending is reformed, if payment formula are reformed. And it's very, very easy to attack another politician for that. And then all of a sudden you get a bipartisan agreement and that reform happens. And because both parties are in it, the attack ads don't fly. And it actually wasn't a big issue. And this dramatic change in the program, which looms enormously large relative to other spending programs, is something that nobody notices. But it's almost like the fear of being attacked that makes it hard to unilaterally touch it, or to have a sort of debate or an implementation of policy that on its face might not be a problem. There is this desire to sort of, and certainly it's understandable why politicians want to poke the Medicare bear, why they want to say, my opponent is cutting Medicare. Now, and Democrats do it very effectively. They do it every electoral cycle. After the Affordable Care Act, Republicans did it. After the Inflation Reduction Act last year, Republicans did it, maybe less effectively, but it certainly clearly has some potency. And so the ability to inflame a concern, which substantively might subsequently not be a big deal, is something that really looms large over these politics. But with a slightly different partisan alignment in Congress, the incentives to make an electoral big deal out of something might be very different, and it might pass unnoticed legislatively.
Now, it does seem as though when you think about the incredibly central role the U.S. plays in the global health economy as a driver of medical innovation, both because of the sheer size of the U.S. market, the affluence of the United States. If you are someone who is advancing a new therapy, a new drug, the United States is going to be where you're going to generate your profits. So there is some anxiety about introducing these more stringent limits on the addition of new procedures, new therapies to the Medicare program. I'm sure you've heard from a lot of people who are very anxious about this prospect. And I imagine what they'll say is that, look, you are going to drain the market. You're going to kind of, sap the market for medical innovation if you do this. What do you say in response?
So I think if you think about a spectrum between completely indiscriminately paying for everything and having tight rationing of essential medical services, with the Medicare programs, it's currently structured on one hand, and single-payer systems on the other extreme. I think it's fair to acknowledge you can find a middle ground where you're being sensitive to the value that's generated without using cost concerns as an excuse for rationing, which certainly occurs in some places. And I think what I have in mind for Medicare is not the single-payer idea that if the government doesn't cover it, then nobody gets it. I certainly don't advocate that and would be fiercely opposed to that. What I advocate is that the government will pay for the existing set of therapies, and then you would pay a supplemental premium if you want access to the incrementally developed new technologies. And we see throughout healthcare, this is a demand that's there. People are really sensitive to...
So really treating Medicare as a safety net and saying that, look, but if you're willing to spend your own money, you're more than welcome to try some of these therapies that have not proven cost effective. But you're comfortable with the idea that there would be a two-tier marketplace here.
It wouldn't even be spending your own money because you would be buying a supplemental premium, and so it would be an insurance money. It would function, I would think, through Medicare Advantage, that you would buy a supplement. It would essentially be a supplemental premium on the same insurance plan. And so it would be the insurance plan that would pay for the new therapy. It's not that I'm proposing that if you have cancer, you would be paying for the cancer.
Chris, tell us about Medicare Advantage, because you've argued that Medicare Advantage is an enormously important, but also promising for the future path for the Medicare program overall. And it seems that it has a pretty important role to play in your vision of how Medicare might be reformed.
Yeah. So, my view is that Medicare currently pays service by service in complete isolation.
Traditional Medicare.
Right. So if you go to hospital, it pays for that hospital admission. If you go to a doctor, it pays for that physician consultation. If you use a medical device, it will reimburse for that medical device. And the payments for these things will have nothing to do with each other. And so to the extent that there are services, the preventive services that we know will keep you out of the hospital, like adhering to medication, like if you have a heart condition, staying on a medication that might cost a couple $100 will prevent a $100,000 potential hospital admission. That's a very, very valuable thing to do. Medicare never joins these up. It never really assesses the value of one versus the other. And so it's very poorly oriented towards doing what we want a healthcare system to do, which is keeping someone healthy, for the best value for money. So what Medicare Advantage does well is it basically gives an insurer generally, or it could be a healthcare system, a fixed amount of money for each patient, adjusted for how healthy or sick they are. So if you're a patient with a history of heart disease, it'll give you more. If you're a younger, healthier senior, then it'll provide less. But it basically will say, here is $20,000 or $100,000, depending on the patient. Take care of that patient for the next year, no matter what healthcare cost it entails. Keep them healthy, provide the essential package of medical benefits in whatever is the most cost-effective way. And there's a whole host of evidence that shows that the outcomes are better, the costs are lower, it encourages more innovation, it encourages more cost-effective innovation.
In fairness, Chris, there is a critique, which is that Medicare Advantage programs endeavor to game the system by, increasing coding intensity. That is to say, by making people seem sicker than perhaps they are. Or, it sounds that you're dismissive of that line of argument.
Scholars debate whether that's occurring, but when the debate is only whether they're overcharging by 2% or 3%. Like, that's a fairly marginal phenomenon.
Which is swamped by the overall benefits of the Medicare Advantage
and actually,
approach.
on average, the Medicare Advantage plans deliver the same benefit package for an average of 12% less. So whether they're overpaid by 2% or 3%, I mean,
it's inframarginal.
Yeah, it's a much less significant issue. The issue, the fact of the matter is that it's the sound design of a healthcare system that also puts the patient in charge. It basically it gives the patient power to choose this and essentially make choices about cost and price, cost and value, which doesn't happen in the Medicare program traditionally. Medicare will basically set a price for every service, as we mentioned earlier. But in Medicare Advantage, the different insurers can often make different offers, can say, well, we can greatly reduce costs by cutting out these really expensive providers, or steering people to these much better quality providers, ones that get much better outcomes and reduce costs over the long time. And that basically leaves the beneficiary the ability to choose, basically as a package deal, which overall healthcare system is doing a better job overall delivering better care at lower cost. And
fascinating. So your Medicare reform approach, you envision Medicare Advantage as a strong complement that would likely grow further in this world, but where the private providers offering Medicare Advantage plans are kind of taking into account these dynamics about new procedures, whether to offer them, and pricing them in a more or less transparent way, in terms of the risk-adjusted premium they're offering to their beneficiaries.
That's right. And I think one important thing to bear in mind about Medicare Advantage compared to employer-sponsored healthcare in America is that for most Americans who have a job, their employer picks their healthcare plan. They say, this year you're going to be in Aetna, or you're going to be in Humana, or Blue Cross. And this is a surprise to people. Open enrollment every year. This is the plan. It's more expensive, less expensive. These features may be more or less appealing. And that's very uncomfortable for a lot of people. And people, I think, rightly resent this in many ways. With Medicare Advantage, you pick the plan. You decide which one actually fits your needs, which one has your doctors that you like, which one has your hospitals that you like, which one's offering value in the sense of the services that you care about at the price that you care about. And if you want to stay in that insurer next year, you can keep that insurer next year. Your employer isn't going to say, oh, we're actually switching again this year, and that doctor that you like, you're not going to get them next year. It really does put the individual in control in a way that we haven't really seen in any of American healthcare, in any large-scale way.
And this is one reason why you've called for reforming employer-sponsored insurance and the individual insurance market writ large, so as to make all of our fragmented health insurance landscape empower individuals and households a bit more in terms of the mix of coverage that they want.
That's right. I think deep down, why is capitalism popular in America? It's because it puts individuals in control. Why is American healthcare unpopular for so many people? Because it takes them out of control. It says your employer is going to boss you around and tell you what your healthcare plan looks like.
And that applies to people on Medicare. That also applies to people with gold-plated employer-sponsored coverage in some cases. Yeah.
The ones with gold-plated coverage, I guess, are more reconciled to it. But most people don't have the gold-plated coverage. Most people are finding their deductibles go up every year. Their network's changing. A great deal of complexity that they never asked for that is suddenly layered on. People aren't crazy when they have enormous dissatisfactions with the status quo. And I think the root of it is that they're not really given the choice and control.
Chris, I wonder, I just want to close on a more philosophical note. You have advanced arguments that are careful, thoughtful, judicious, but also very contrarian. When we're looking at people who are thinking about the entitlement challenge, about the need for fiscal consolidation, first, you seem strikingly optimistic relative to the status quo in that world of policy experts, which is interesting in itself. But also you'll find a real consensus, elite consensus at least, including among fiscal policy experts on the center right, about the need for revenue increases. And what I'm hearing from you is that actually that constraint of not allowing revenue to grow all that much is something that is really important for nudging lawmakers towards entitlement reform. Is that a fair characterization? Is your view that this classic argument that, hey, we all have to meet across the bargaining table and, maybe we'll make some concessions on spending, we on the center left, if you on the center right make some concessions on taxes, it seems that your counsel is no. Let's not make concessions on taxes because that actually muddies the picture.
Yeah, I mean, I certainly think that a hard budget constraint is the root of so much in terms of getting a good deal. I certainly remember in college I read the book by Janusz Kornai on the Soviet Union, and it was called The Socialist System. And he really identified as the root of the Soviet dysfunction the fact that there were no hard budget constraints. Every single business in the Soviet Union could ultimately, if they were producing something important, rely on a central bailout. And so that meant that the costs would get completely out of control and you couldn't get value anywhere. There's a real sense in which the essential element of capitalism that you need, the thing that makes the system work, is the hard budget constraint. And I think you can think about, well, apply that to government as well. Like how do you make government work effectively? If you're always providing new revenues, well, they're not going to ask hard questions of anybody. They're not going to put anybody's feet to the fire. And really squeezing on the revenue is really what really forces them to keep costs under control. The easiest thing in the world is to let costs bloat indiscriminately.
There's an argument that's emerged among some voices on the right, which is that essentially conservatives ought to embrace the welfare state. They ought to embrace social insurance. They ought to embrace entitlements because these things are very complementary to robust market capitalism. And your argument, as I understand it, both when it comes to Medicare and Social Security, but also in many other domains as well, is more that, no, we should actually embrace the idea of a narrowly cabined safety net subject to hard budget constraints rather than the idea of a very extensive middle-class welfare state. And I wonder, why are you so convinced of the virtues of that approach, of thinking about, entitlements, thinking about welfare writ large as something that is very much a last resort or something that you use, if you don't have a good, robust private alternative?
Well, I mean, I guess it's a question about me rather than a question about the nature of the policy preference. I think in terms of my experience, I think it's really, I grew up in England, and what you kind of see in the world that I grew up in, which was sort of like, you look back at the post-war British experience where government went essentially as far as it could go. The government spending went as far as it could possibly go. Taxes were increased up to 97%. The unions were given control over industry. And did that actually deliver what it was claimed? Like, if you go down the path that is claimed by advocates of social insurance, if you go down the path that is claimed by advocates of managed competition or advocates of trade union power, what do you actually see down the end of that road? And the answer is you just kind of have pretty much indiscriminate bloat, a lack of accountability, you end up with dysfunctional systems absorbing resources from well-functioning systems. So you end up with inefficient enterprises drawing capital from efficient enterprises. We end up with a welfare state where people who don't need assistance draw disproportionate amounts of resources away from the people that do need assistance. And you have no real ability to navigate really the basic question of where do resources need to be allocated. And there's no real accountability that kind of distinguishes between what is essential and what is essentially people just claiming resources to the extent that they can get away with it. And I think that the essence of this, I mean, ultimately, from a scholarly point of view, Hayek is right in his Use of Knowledge in Society paper. It's that you do need markets to force accountability, to discover what people's genuine cost functions are. They're not going to tell you what is the best that they can ever produce something for, or the least resources that you need. You need competition to essentially disclose these kind of facts that people naturally will keep quiet, because most institutions will ultimately try and grab as many resources for themselves, regardless of need, as they can get away with. And generally, the most powerful institutions, the ones with the least needs, if left to do so, will grab the most resources, and those with the greatest needs will not be able to get so many resources. And so you really do need market processes to force people to disclose their private cost functions, and force institutions to disclose their cost, or force institutions to disclose their cost functions, and force individuals to disclose their needs, their genuine needs and capacities. And without markets, you're essentially falling back on politics, which tends to empower those who have the least sort of unmet needs and the greatest resources.
So what you're saying is that the cutting-edge thinkers, both on the left and the right, who envision a more expansive investment state that's subsidizing a panoply of social services for the American middle class, their bright vision of the future is, to you, basically England in the mid-late 1970s.
Yeah.
AOC is Michael Foote.
Yeah, and you down that road lies trash not getting collected, and like the dead not being buried, and people not doing essential jobs and services, and the country deteriorating. I mean, I also think fundamentally that most people don't want that. Like, that's a very unappealing situation to most voters, and thoughtful politicians, sophisticated politicians, and analysts can structure the political process so that the downsides of that are pretty clear to people before you go very far down that road. So I don't think explained carefully or with choices framed so that trade-offs are clear to people, that it's really going to be something that is particularly appealing to more than a small minority.
Chris, thank you very much for joining us.
Thank you. It's been fun speaking with you.
Listeners, don't forget to check out his work for the Manhattan Institute. We'll link to a scholar page in the podcast description. If you like what you heard on the podcast, please feel free to write a review wherever you listen, and be sure to tune in to future episodes of Manhattan Insights. I'm your host, Raihan Salam.